So I see a lot of men in my practice, and one of the things that comes up is I notice that they are able to be vulnerable in therapy. And I kind of get really curious with them, how come you're vulnerable here, but they're not able to be vulnerable with their partners, with their family members, with their friends? And it's because of shame. Right? We live in a society that perpetuates shame in lots of different ways. We do it all the time, to each other, in subtle ways. And that, for black men, particularly for black men, they have learned to kind of internalise them, right? From very young ages, even myself. And because you learn to internalise it, you don't actually learn to actually talk about actually what's going on for you. Because you're expected to just hold things together.
What are your legal rights if you've been unlawfully detained in a mental health hospital?
Yeah, if you're unlawfully detained in a mental health hospital, you have the right to appeal, but you have the right to go to court as well and seek compensation. Those are things you can do when you're unlawfully detained.
They completed suicide in 2019, and it had a profound effect on me. Not just the loss, but I was once in my cousin's shoes. I'm going to break it down as a black man. You're going to hear some rawness, and I just ask you, just bear with me. So, growing up in a Jamaican household, it was either, if Uno can't hear, Uno must feel.
Sleep, and that is it. And he would only discipline when mom said, you know, I did such and such and thing, then it would be the bell or the kettle cord or whatever. And so the attachment was not there. So I couldn't come and talk to him about relationship problems. I learned that off the street from my cousins and stuff like that. So I had a negative view of things.
The one thing I would say with Black Men Consortium is that we have been able to do a lot of stuff in the NHS when it comes to psychiatry. We have put on workshops within psychiatry, and we are continuing to do this with the NHS, also with places like Mosley Hospital. But for me personally, with the Black Men Consortium, is that I myself am mastered in family psychotherapy. And the one thing that it has done for me, it has allowed me to expand all the things I'm learning and to try and bring it to a space and see how well it works with not just black men, but with people of color, and to identify things that are not working within our community, and to try and see it or refine it that it works for us. So that's the one thing I'll